Thank you so much for joining us for this edition of All Angles. I'm Dion Janks Miller. Coming up a little later in the program, we're going to be talking about our disaster readiness, especially following Tropical Storm Grace. But first, with the Ministry of Health having announced today that the Delta variant has now been confirmed as being in Jamaica, we're going to be getting some comment on that. I spoke earlier this afternoon on radio with the Chief Medical Officer who said the variant has been confirmed in at least 7 parishes and that transmission seems to be widespread. Its existence seems to be widespread. So we're joined in this section of the program by Dr. Johan White. Dr. White, thanks so much again. We appreciate you talking to us as always. It had been... Okay.
Thanks for having me and good evening.
Yeah, it had been suspected, widely suspected, when people saw the numbers over the past few weeks that Delta was here. It's now been confirmed. Does that mean anything different then in terms of actions taken that should be taken by the government?
Well, from the Ministry of Health press conferences, from their utterances, they had indicated that they already considered the possibility, the high possibility, probability that the Delta was here, and their actions were guided accordingly. I think for the general population, believe it or not, there are persons other than those who are denying the existence of COVID. There are others who felt that maybe Delta was not here. So I think maybe in terms of communication and understanding, some persons will now be a little bit more cautious than they were, knowing that the Delta is confirmed to be here. But in terms of the public health response, we do know that Delta is far more transmissible from the scientific data, maybe at least twice as transmissible. So 2 times more easily transmitted from one person to another. And in some papers or some countries and jurisdictions, it's been documented to be maybe 5 to 10 times more transmissible. So it passes more easily from one person to the next. And as such, we really do have to continue to be vigilant and reinforce infection prevention measures, the hand washing, the staying away or staying home. If you're having symptoms, staying away from gatherings, so the parties and the large weddings and funerals, those are high-risk situations. And mask wearing is very important for interrupting transmission.
I've seen some indications, the CDC, for instance, Centers for Disease Control in the United States, is saying that some studies indicate that the Delta variant may cause more severe illness than other variants.
Yes, initially it didn't appear to be associated with more severe outcomes. For sure, it's not certain whether it contributes to higher fatality, but we're seeing where it looks like more people or a higher proportion of persons are ending up in hospital. Now, that could be due to the fact that more people are becoming infected, but it also seems from the data that maybe a higher proportion of persons who are infected also end up in hospital compared to other variants or the initial strains of the virus that causes COVID-19.
So what are the implications of those factors that you've mentioned then? What are the implications for us, given what we've already seen in the past few weeks?
I think the biggest thing to realize is that it pushes the herd immunity threshold higher. And this is something that I don't hear being discussed enough. We are used to hearing about 60% of your population needs to be vaccinated to reach that herd immunity threshold, which is where you sort of have balance with the virus and you get control of the pandemic. With a more transmissible virus, that number goes up above 60, above 70. So between 80 and 90% of your population now has to be immunized. But the good thing is that practices such as mask wearing and hand washing and physical distancing also contribute in a sense to taking that threshold down. And of course, persons who have been infected and recovered, even though they still do better with vaccination, that there's some limited or short duration protection for persons who have recovered from infection. So all of those sort of chip at that threshold such that in reality it's really not 90% per se, but it's a higher target. It means that we have to vaccinate a larger proportion of our population and at a much faster rate.
Well, that's the thing, because the CMO confirmed for me today that we're still just at about 5% of the population fully vaccinated and about 10%, she said, of people who have had at least one. So
Yes,
that's a way, that's way far from the 80% you're talking about.
it is, and we've got work to do. It is very unfortunate. A part of the issue is that wealthier countries are holding on to the vaccines, which is unethical and just really, really unfortunate. Although recently, countries like the US and the United Kingdom have started to make large donations to third world countries or to developing countries like Jamaica, and that is welcome. But even with the availability of those vaccines, we are seeing that there is reluctance to accept these vaccines, and there is need for more conversations. I was talking with another reporter today about the education sector, for example, parent teachers associations, teachers professional groups, parent groups. We really need to have fora to engage these individuals and to answer their questions, see what their concerns are about the vaccines that are available, about side effects, about the risks of getting COVID-19, because people are talking about risk factors like blood clots and myocarditis from the vaccines, but you can get blood clots from COVID-19, the disease, and you can die from COVID-19, the disease. So we really do have to have ongoing, sustained conversations, not a one-way communication or blasting all over the media, etc. I think people really need to be engaged. We really do need to engage the physicians more, because every physician has a pool of patients that they have a relationship, their patients trust them, and the physicians need to be empowered and mobilized to engage their patient pool to promote acceptance of the vaccines.
The Ministry of Education is targeting mid-October for a return to face-to-face schooling. We all know it's important, but given the presence of Delta and what we're seeing in terms of the current surge, what do you think has to happen for that to be possible?
I have not been privy to a plan from the education sector in terms of the reopening of schools, but in that conversation, in that plan, there needs to be discussion about testing, right? So if we're putting back students and teachers in the classroom, in addition to the infection prevention measures like physical distancing, insofar as that is possibly in our classrooms, there will have to be phased reopening of schools. I don't think everybody will be able to go back at the same time. Also, different age groups will have different considerations. So early childhood is one that is of particular concern to me, because how do you maintain physical distancing with toddlers and young children? So we have to be discussing the practical rollout or implementation of reopening of schools. We have to be discussing testing. If you put back people into the school environment, how do you put systems in place to enable access to testing such that you can identify persons with infections promptly so that you can isolate them from the rest of the school population? If you are putting back people in that setting and do not have adequate systems for testing, that is going to be problematic. If you look at developed countries like the US and UK that are discussing and reopening schools, testing and access to testing factors in significantly. That's an important consideration. Do recall that even though children do not fare as badly as adults, even though they do have complications, it's a lower proportion of children who do have complications compared to adults. But children are effective in transmitting the virus. So they're going to take it back home to their loved ones, to the elderly and vulnerable persons in their household, and to the adults. So we also have to make sure that we promote vaccination again for parents, for families, for teachers, and for other workers in the education sector. So a lot to consider, but there needs to be a comprehensive plan, and I can't say that I've seen that. It may exist, but I've not seen a solid plan from the education sector. Of course, education won't be able to do it by themselves. It has to be collaborative across government, but that plan needs to be thought out properly.
Going to have to leave it there, Dr. White. Always appreciate your time. Thank you so much.
Thank you for having me.
And stay with us when we come back after the break. Going to be talking disaster management and preparedness, or lack thereof. Remember, our hashtag is TVJ. All angles soon come.